Hello, today we're going to be talking to you about a treatment that's been around since 1940, and it's a treatment that's been used for all kinds of joint pains, and today we're going to focus in on lower back pain. It's called prolotherapy. It was initially developed in the 1940s or so with Dr. Henwall and some of his other surgeon friends, and they developed this as a treatment to help heal joint pain. You can have joint pain for a variety of reasons. Arthritis, and when we think about the lower back, people will have arthritis, they will have degenerative disc, they'll have bulging disc. All of those things can cause a great deal of chronic pain and limit a person's ability to function on a daily basis. And this treatment is aimed at healing the weaknesses that are in the joints. So cartilage and joint muscles, joint tissues are what are actually supporting the lower back, and when they become weakened, we have pain. So this treatment wants to use the body's natural ability to restore and repair itself. It stimulates that function, and when you get stimulated enough, you have enough restoration of the tissue growth, then you have less pain. So this is a wonderful opportunity I like to present to my patients because it does give them a chance to avoid having surgery and avoid using pain medicines on a daily basis, which can be toxic to the body. So we want to do something to help naturally build the body back up and get rid of the pain. So today we're going to show you a treatment using the lower back pain. I have a fabulous volunteer here. This is my husband. He has lower back pain, and every once in a while we have to do a treatment. He doesn't have any severe arthritis, so we don't have to do it very frequently, just when maybe he overworks and does not recover very quickly. But for my patients that do have severe arthritis and damage to their back, we may have to repeat those treatments. We do them every 4 weeks. We receive those injections in the area that has been injured every 4 weeks, and it depends on the amount of injury. I describe it to people like if you cut your arm, your finger with a little knife cut, you're healed in 2 weeks and you never think about it again. You go and have bypass surgery or some other major surgery on the body, you're trying to heal and recover that body 6 to 9 months. Get a knee replaced 6 to 9 months or a year or more to actually get the body to be totally healed. So the same with prolotherapy. Even though it isn't an invasive procedure, still how much the body heals and recovers each treatment is going to depend on the amount of injury that's there. So that will vary how many treatments that a person actually needs. So let's just kind of see the area. As far as the safety of the procedure, I dare say it is as safe as using aspirin. You know, the biggest part, we are going to be using needles and it's uncomfortable, but you'll see it's a very short treatment. We do some things to take away the initial bite of the needle itself, and that tends to make people comfortable enough. Afterwards, after the treatment is over, we use heat and natural soothing oils that help to relax the muscles and take away a lot of swelling and pain, and they do pretty well. Most people kind of get up and go on with their day, and there isn't any really downtime after the treatment. Those with more injury can have more aching afterwards, but the majority of people within 24 to 48 hours, they're up and back active. So let's go ahead and get started.